Health officials say COVID-19 is no longer a pandemic in the United States, but how does the virus affecting us compare to the height of the pandemic? ABC 7 medical contributor Dr. Ogechika Alozie with Sunset West Health is here. Dr. Alozie, as an infectious disease doctor, where do things stand right now?
I think the important thing today is that this is not 2020, it's not 2021, it's definitely not 2022. If we pull up the graphic, what we'll see is that in as much we were really traumatized by fall of 2020, we had the most cases actually in 2021 when we had the Omicron spike, right? But you can see where we are now. We're down across the board in positivity, hospitalizations, and deaths. These are all good things, and they're based off of two things specifically. One is the vaccination, and two is that there's estimates that up to 95% of the people in America have already gotten COVID at least once.
Oh, now what are the estimates of COVID-19 infections and deaths looking ahead? We have this graph here.
Yeah, so I think this graph is sort of complicated to read, but I think what it shows is that over time we've gone from BA5 to what's now called XBB. We expect this virus to mutate. It's going to constantly mutate. I think when I look at it, however, I do not expect us to ever go back to the stage that we were in 2020 or even 2021 with Omicron because the amount of natural and vaccine-induced immunity that we have in the community.
Now, other than the Moderna and the Pfizer vaccines, which prevent COVID-19 or at least lessen the symptoms, what treatments for COVID-19 are currently available?
Yeah, so the two of them that you see on the left, Paxlovid and Lagevrio, are outpatient medications, right? So you can go to your physician, your clinician. Some pharmacies can actually prescribe these, and these should usually be given within 48 hours if you have signs and symptoms of COVID and you test positive. The other one, Veklury, which is remdesivir, we still use in the hospital. You know, what's interesting is that there's a lot of data that now shows that even though these are effective, they're not that great anymore for people that have already had COVID and people under the age of 50. And so when people call me, I say, hey, let's assess your risk factors. It is no longer a one-size-fits-all, and there's nuance in this.
And as we mentioned at the beginning of the segment, COVID no longer a pandemic.
Yeah, and so the public health emergency, which was initiated in 2020, is really coming to an end in May of this year, May 11th to be exact. What does that mean? If we go to the next slide, we'll start to see a host of things that are going to sort of peel away. Hospitals have been getting a financial boost for taking care of patients with COVID. That's going to go away. People have been getting free medications and vaccines. That's going to go away. A lot of us don't know about this, but as a physician that's been dealing with this in the hospitals, what has happened is that we've had to transition people into what are called skilled nursing facilities quickly, and there's been a relaxation of those requirements. That's also going away. What's really interesting, and this I think is going to be subject to debate over time, is that some of the protections around telemedicine are going away. But what you see there is that 73% of the people that have used telemedicine during this pandemic still expect to have it offered. And so I think clinicians out there need to know about that.
And I found this interesting on what you found when it comes to masking up.
Yeah, and so masking has been controversial throughout the pandemic. Whether to mask, whether not to mask, what type of masks. You and I have talked about masks a host of times. The Cochrane Review, which is really the sort of gold standard when it comes to data reviews in healthcare, recently came out and said that on average, a lot of the masks that we use don't seem to cause any reduction in spread. There's little to no evidence that they reduce COVID-19 at the population level. The question then is, should you still wear a mask? And I said, it depends. I mean, my kids don't wear a mask. They play sports. They go to school. I don't wear a mask in social settings. I still do in hospitals. And each individual may or may not need to wear one depending on what their risk factors are.
ABC 7 medical contributor Dr. Ogechika Alozie, as always, thank you very much.
Thank you.